Hi everybody, it's been such a long time since I posted anything. My name is Irina Kala and I'm a graduated student of acupuncture school and newly licensed. Very happy to actually say that. And today's video is going to be about a very interesting topic. It will concern those who are parents or who are planning to be parents, and actually those who possibly struggled with unknown diseases that has formed over time and it's like out of blue. So I have this really cool book. I'm going to show you the cover. Acupuncture treatment in children. It was written by British authors Julian Scott and Teresa Barlow. Really fascinating book. I came across it not so long ago. As far as I know, this book is also can be found in Russian language, but mine is in English, okay? And this is a great book for a pediatric acupuncturist, as well as just regular acupuncturists who wants to expand their knowledge and perhaps see more children in their practice. Children react really well to acupuncture really fast. And this is great because they're not stagnant yet. Everything is flowing. It's easier with children. And if you know how to connect to them, it's going to be no problem to put a little pin, okay, a little needle in their body. This book is fascinating. It's complex, but at the same time very easy to read. And if you're not an acupuncturist and you're just a curious parent, pick this book up. You'll find so many interesting things for yourself and how to aid your kid without putting antibiotics in their body right away, thinking that is the only way how you can get rid of a problem. Yeah, it's pretty amazing. What caught my attention is a particular chapter on infectious diseases. We know it's a thing, especially recently. Infectious diseases is it's a problem, a big problem. So, chapter that got me very excited and curious to express and share it was immunization and their side effects. And I'm gonna read some of the parts of this chapter to you. And before I go into this book, the reason why I even started all of this is that when I read it, I talked to my mom, and guess what? I have every single vaccine in my body, every single one. And when I asked my mom how come she didn't omit any of them, she said, well, I trusted my doctor. My doctor said I should get it for you, so I did. No genetic testing, no blood work, no nothing. They just said it's good for me. But guess what? In the eyes of the modern world, I am a very healthy person. I'm not taking any medication, okay? Chinese herbs from time to time. I do get acupuncture, not on regular basis, but I do, and I usually administer it myself. But I'm fine. Like, honestly, the things that I struggle with or used to be of unknown origin to me, and they're just chronic things that come up only when my defenses are low, when my vital energy is low, when I'm exhausted, when I'm overextended. And this is something that everybody should probably watch out for. Not overextend yourself, because that's just not gonna go really good for you. Every weak link will show up. So let's go straight into the book. And the first title is Error in the Theory. Okay. Number 1. Immune system is not merely a system for generating antibodies. I love this expression because it's so true. It's not. We, by the way, have 5 types of immune systems, and if you're not familiar with them and what they do and how they work, Google Google and you must find this out for yourself, because until I was a medical student, embarrassing to admit, I did not know any of these things. Pretty embarrassing. But I decided not to look at it as an embarrassment, just misinformation or none. Like, no information just came my way. And people live with not knowing, and it's totally fine. But this is something that concerns your health, your well-being, how you interact with the world. So why not to get informed about this thing in particular? So there's a series of complex reactions which occur for the body to overcome disease. Antibody response is simply one part of this series. One part, not everything. Keywords. Second, beneficial bacteria are an important part of our defense against disease. It has been shown on the bacteria on the skin and in the gut, mainly beneficial, and then the bacteria themselves play an active part in overcoming other bacteria and viruses. Wink, wink. Therefore, building up the population of beneficial bacteria is just as important as building up antibodies. Isn't that amazing? I mean, everybody knows that your gut is your second brain, if not the first one, honestly. And we know if your digestion suffers, most likely you will have some other pretty serious problems, including those things like anxiety and depression we love to talk about, but not limited to that. But just saying, your gut is your everything, okay? And the third factor that they're talking about is that by strengthening one part of the immune system, you may weaken another, okay? Immunization does not come with only with benefits. It has risks. It has immediate side effects, like short-term reactions, as well as the long-term reactions. And the long-term reactions is the thing you gotta be on the watch out, on the lookout, right? We all sort of started hearing things about immunization and the side effects and such and such and such. It doesn't have to be dramatic. It doesn't have to be paralysis and stuff like that. You might have a pretty strong and general immune system. I'm talking about all 5 of them. But you will still have some lingering things. First of all, like the 3 very important long-term effects from any kind of vaccination would be diminished vitality, because guess what? Immunizing agent is still a disease. Not flowers, they're not giving you candy. It is still a disease, which means your body needs to work to overcome it. So, diminished vitality, or what we call qi deficiency in Chinese medicine. Phlegm. Oh my God, phlegm. We only know phlegm as something that we're hacking out, or the snot, right? It's not just that. We have phlegm and we have thick phlegm. Phlegm, guys, it's non-usable fluid that gets so thick. It gets stuck anywhere and everywhere. And I'm talking like brain, spine, your nervous system, your blood vessels, interstitial spaces, all those places, thick phlegm can get stuck. And from there, you only have to sit and wait for unknown symptoms to show up, and you just cannot pinpoint where the hell it's coming from. So I've been struggling with recurrent chronic tonsillitis, okay, and tonsil stones. And they're telling me, oh, it's convoluted tonsils and you just having a little bit of food stuck in there. And guess what? It's not just that, because sometimes my tonsils are closed, like the lacunes, and the stones are still forming. I'm not gonna go into diagnosis at all in here. I'm just saying it's a thing. And as I already mentioned, I as a person have every single vaccine in my body. I don't know how well it was spread out, but I remember as a child, I had nightmares for the longest time. I had nocturnal enuresis till pretty long time, like up to 10 or 12 years of age. This is serious. I had terrible eczema. Oh my God, I had patches this big, angry, very itchy, flaky. Came out after 3 years of age. And guess what? Many vaccines are going right at that time. My digestion has never been optimal, unfortunately. As a behavior, this is something important to see in your child, how their behavior changes after vaccination. They might not behave themselves. There's a reason for it. Imagine yourself sitting in front of a window, and the window is getting dirtier and dirtier and dirtier. Can you see the outside world? No, you can't. How much Windex do you need to use on that to clean up? So that's what happens with thick phlegm. Perception of the world changes, your behavior changes. You might be more aggressive or more like sleepy, more lethargic. You might have digestive issues that will stay with you forever. All those allergies that we're speaking of nowadays, like, where the hell? Like, how come? Why so sensitive? Why all of a sudden so sensitive? So yeah, I was a child that did not have allergies, but very sensitive. If anything, I start crying. Anything and everything, just everything is an irritant. Like, I see how those things impacted me. So I just want for all of you to be aware of. I'm not gonna go in particular long-term side effects for all the vaccination stuff, but I do wanna read this particular thing, the contraindications, okay? From the conventional medical point of view, much depends on the individual, but in general, immunization are contraindicated when the child has convulsions, fits of some sort, there's a family history of epilepsy, okay, the nervous system is already doing that great, the child has a weak immune system and suffers from recurrent coughs and colds, like, don't do it. The child has already had the disease, like, come on, why to have the vaccine if the child already has the diseases? And hyperactivity in kids. Also, another thing, just to say, make sure if you do get their child immunized, for their immune system, for their digestive system to be on point. No accumulation, no, like, their stool has to be on point, no burping, no gassiness, none of that, okay? Because if they do have that, the recovery is going to be more difficult. Digestion for a young kid is everything. Never forget that. Also, spreading the vaccines, spreading it through, and not just according to vaccination calendar, but according to your child's constitution. You as a parent will be able to see, oh, my child is doing well, or they're not doing so well. Their behavior has changed, their patterns has changed. Every mama will know that. So that's something else I would love to, I guess, recommend. And I did want to go into a couple of things that I found interesting to see here. So The authors of this book are in general pretty neutral, and they do say there's no right or wrong, it's all up to you, you have to make your decision. But their opinion, I want you to read their opinion. They're doctors, okay? They have clinical experience, they've seen children from 0 to 20, 21 growing up. They've seen their patterns, and there's nothing better than a clinical experience and the practical approach to things that happen. So what they're saying, on the whole, we are against immunization. The short-term side effects can be treated effectively with acupuncture and are therefore not to be feared. And we do fear. We just don't want to get sick. But guess what? It's not a reality. You do get sick and you overcome it. And if your child, or you when you were a child, had measles, you had the toxin expression on your skin, people. That's how body vents things in general, unless you somebody beat you up or cut your skin. There are no skin diseases. Everything that shows up on the skin comes from interior for the most part. So like measles, the toxins are coming out on the skin. Okay? However, we feel that the long-term side effects can be seriously detrimental to the health of a child and remain with the child for life, causing problems that can surface many years later. This is what we forget. We don't put one and one. Oh yeah, immunized with age of 3, age of 23, a weird autoimmune showed up. Where from? How come? Something must have triggered it. And yes, we have plenty of stressors nowadays. But just stress, unless it's over a long period of time, does not cause things that are unexplainably terrible. Okay, we also feel that there are diseases such as measles that are positively beneficial for the child to have, since they're clear poisons from the body that otherwise remain in the system. So they're talking about that expression of toxins in the body, because it doesn't clear just itself, but other things through the skin. It vents it out. We do not want to get into the situation of frightening parents away from immunization. This is important to know. We're very careful in what we say and how we say it, trying to point out objectively how the particular child is likely to react to an immunization. Okay. Certainly, not all children suffer ill effects from immunization, and that's true. I didn't have any terrible side effects. Many cope well, but some do not. We feel that we have to point this out to the parents of those children whom we feel would suffer as a result of immunization. They're pretty fair, let's be honest. And I do want to read some more from here also. So, okay. Immunization are routinely given to all babies unless there are strong contraindications, because according to Western medicine, there are no disadvantages to giving immunization, only positive benefits. What? No. In the wider view of Chinese medicine, however, the simple view is rejected. Not only is there a significant risk that a disorder related to a lingering pathogenic factor will develop in the weeks following immunization, but in the case of the eruptive disease of measles, mumps, and chickenpox, there is an actual disadvantage to being immunized. Disadvantage, guys, to being immunized with those things. Immunization prevents the expression of inherited toxins. It's one of the ways your body can get rid of some toxins, to express it. With immunization, you don't have that. A full discussion of this is not scope of this book, so they're not going any deeper, but they're definitely do talk about which vaccines probably you should omit in general. So first of them is measles. Avoid getting this immunization, and they're explaining why. According to the statistics, the reason for immunizing is that there's a significant risk of brain damage from measles. That's true. In fact, the children most at risk are those who have a history of febrile convulsions, and these children are equally at risk of brain damage from the measles and the immunization. So check this out. The risk of brain damage in healthy children is slight and very slim. Furthermore, measles is a disease which provides an opportunity for inherited toxins to come out, because you do pass certain things to your kid. Like mama, papa, you do that. Okay. Then pertussis, or well known as whooping cough, or 100-day cough. This is still a dangerous disease, and even when there is no risk of brain damage, there remains a significant risk of injury to the lungs, which can cause trouble much later in life. However, pertussis responds well to acupuncture. You don't need to vaccinate, because there are other forms of medicine that you can administer to your child without putting anything unknown or dangerous into their body. The needles are sterilized, okay? Not dangerous. Thus, if acupuncture is available, immunization is unnecessary. But if acupuncture is not available and the child is sickly, then the decision is not too straightforward. They're always speaking, if you have the access to things to support the child when child gets sick or prevent getting sickness, then maybe stay away from immunization. If you do not, then think twice and make an informed decision. Not just a decision, informed decision. Okay, that's very important. Polio, I've got that one too. Man, that thing creates thick, white, almost impossible to get rid of phlegm. And I'm talking about phlegm that is getting stuck places that you would never believe. So, let's give a quick one here. Although the crippling effects of polio are far from beneficial, and we all know that, there is now strong evidence to show that most children contract polio, but are unaffected by it. Most children do contract by unaffected by it. So they simply develop a high fever. Those children who become paralyzed already have some kind of defect in the spinal cord. So we're talking about predispositions, okay? For healthy children, just high fever. So why to immunize against polio? If your child immune system is good, why to weaken it? That's my big question. Why? Just because you're afraid? Just because media brainwash? Just because your doctor tells you, no, you gotta do it because of blah, 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 blah. Because there's a slim chance your kid can get paralyzed. If I would be my mom, I would definitely say, hey, I'm gonna take my risks. Because for me, the benefits of immunization of this sort are almost nothing. That's true. But that's only my opinion, guys. Like, don't put any comments saying, you baba baby badger do. This is my opinion. I'm just sharing things that I found, okay? Yeah. And the last sentence of the polio thing is, we believe that these children who already have defect in the spinal cord are very ones who are at risk from the vaccination. So go figure this out. And there's much more, and you read through it and you just say, oh my goodness, and I didn't know anything about this. Even if you're just a curious adult, pick up this book, read some more, and I'm sure you'll be able to trace some of the patterns that you're having in your health history related to one of these guys. And as I said, immunization is not everything. We cannot blame just immunization, but it's a big chunk. Big chunk. Other things are stressors and how well we cope with it. But anyway, I just wanted to share something that I found, and perhaps it will be useful for you, and perhaps it might help you to make the informed decision. Or maybe you'll say, this video is crap, who cares, I don't care, I'm just gonna listen to my doctor. That's also your decision, but at least decision is in your hands. You have to trust yourself. You have to gather as much information as possible. Do not just give your health fully to somebody into their hands, because it's your health and you live with yourself. Not your therapist, not your acupuncturist, not your chiropractor, you. Don't disregard your feelings. Don't disregard knowledge that you acquire. Have more trust in yourself. I hope everybody is well, and this was somewhat useful. Bye, guys.